Alright, what is this? Spleen, but it's a large spleen, okay? How do I know the upper border from the lower border? The notch, yes, this is the notch. So this is the upper border, this is the lower border. This is the hilum, right? Okay, understood?
So lowest is it? Thank you.
You're welcome.
Lowest.
I mean, show, demonstrate, yes.
Demonstrate, okay.
Yeah.
See this right here, this is the notch, okay? Yeah? So this is the upper border, this is the lower border. Okay? Sometimes in the spleen, there's no notch. Okay? For any reason, splenomegaly, whatever. Okay? So how do I differentiate? I look at the hilum. So the bigger surface is the gastric surface.
Yes.
Which one's bigger, this one or this one?
So,
This one, yes, this is the gastric surface. So this is the renal impression. Okay, and this is anterior, so this is the anterior part, this is the colic. Understood? This is all important in the spleen, that's all. Again, this is all what's important in the spleen. First of all, what is this organ? It's called spleen. You're going to write down spleen. Very good. You got half a mark. Okay. Then the impressions is very important. Of course, the blood supply of the spleen is important. You already know that, okay? So above, if you find the notch, that's good. Then you know upper from lower. But if you don't find the notch, look at the hilum. Which surface is bigger? This one or this one? This one. So this is the upper surface, this is the gastric surface. This is the renal, okay? And this is anterior, so this is the colic. No, it's very small. We never bring it because you always get confused. Okay? Look at this one. Where's the notch here? Is there a notch? No notch. But where's the where's the biggest surface? Oh, yes. So this is the gastric surface. This is the renal surface. And this is the anterior surface, so this is the colic. Understood? Yes. Alright. Put the spleen on the side. What the hell is this? Yes. It's a kidney, right? This is the kidney.
nice,
Okay?
nice.
Thank you very much. Alright. So the most important, or the key word in the kidney is to look at the ureter. Okay? The ureter will tell me what's anterior and what's posterior. It'll tell me what's above from below, and the hilum is towards medial. Right? So is this a right kidney or a left kidney?
Right.
Who agrees on right? Who else agrees on left? Okay. Who doesn't agree on anything at all? Okay. So this is a right. Why did they say right? Look at this. This is the ureter. It's directed downward, so this is above and this is below. This is the most posterior structure, so this is in front and this is in the back. And the hilum is towards the medial, so it goes like this. Alright, so this is the right kidney. The most important questions is the relations. Yeah, the posterior relations of the kidney, the blood supply of the kidney, whatever. Okay? So is it easy? The only tricky thing is to differentiate between right and left. Or the ureter. You might tie the ureter in the exam, like what happened today. The ureter was tied in the exam, and they asked them, what two constrictions? Yes, exactly. Very good. The two constrictions of the ureter. Okay? Well, there's four, but they only wanted two. Okay? Easy? Okay. How about this kidney? Is this a right or a left kidney? Look at this.
Right.
Beautiful. Beautiful kidney. Right or left? Right. It's also a right. Right? It's a right? Okay. So this is a liver. The day yesterday, what got in the exam? This one. What is it? The gallbladder. Yes, the gallbladder. Okay. If we consider this an H shape right here, consider this an H shaped. Okay. So this is the gallbladder. What's on the opposite side? Inferior vena cava. Yes. What's opposite to the inferior vena cava? Ligamentum nosum. Ligamentum pars. Understood? So it's an H shape. Look for the gallbladder. Okay? Opposite the gallbladder on the other side is the inferior vena cava. Opposite the inferior vena cava here? Opposite the ligamentum venosum here?
Ligamentum pars.
Easy? You sure? Yeah. What's the difference? Where's the caudate and where's the quadrate?
Quadrate is
This is the
below.
quadrate and this is the caudate. Quadrate? Looks quadrate right here. See, this is the quadrate loop. This is the caudate loop. Understood? Huh? Does anybody want me to repeat anything?
So what's the question for this exam?
I'll tell you. Sure. Okay. If we look here, we're trying to find something. Okay. So the most right in the port, this is called the porta hepatis, right? H is the porta hepatis. The most right structure is common bile duct. Yeah, common bile duct right here. Yep, right there. There's supposed to be here something called the hepatic artery, but unfortunately I think it got cut off or anything like that. Behind them there's the portal vein. Understood?
Yes.
Is it easy? Are you sure?
Sure.
Again, this is the porta hepatis. This is towards the front, right? This is towards the front. So the most right structure is the
Common bile duct.
next to it on the same level is the hepatic artery. Behind them is the portal vein. Understood? Okay. Regarding the impressions, where's the right loop and where's the left loop?
Right here.
This is the right. This is the left. So do you think, is there a gastric impression on the liver?
Yes.
Yes. Would it be towards the left or toward the right? Left. So the gastric impression is right here. Right? Understood? So this is the gastric impression. Gastric continues here. The stomach comes the duodenal impression, right? Okay, and then there's the colon in front of it right here. Yeah. So transverse colon, exactly. And there's the renal impression. The most two important impressions is the renal and the gastric. Understood? Okay. Last but not least, this is what this ligament called falciform ligament. Okay. It could ask you about the loops. It could ask you about the blood supply. It could ask you about the gallbladder. It could ask you a lot of questions about the liver. Okay. All of it is present in the practical book. You know the practical book? All the questions that can come. Understood? All right. Let's look and see what we have here. What is this?
Stomach.
What is this? Come on.
Stomach.
This is the stomach. All right. It could be a separate organ. It could come as attached to the body. Okay. Is there any problem towards that? And any question can come on the stomach. It's not hard. Huh?
Abdomen.
You understand? Why are you quiet today? You're not normal. Okay, so this is the stomach. Okay. What is this right here and what is this right here? This is the inferior vena cava. This is the aorta. Very good. So this is the inferior vena cava and this is the aorta. It's not charging. Okay. All right. So this is the inferior vena cava and this is the aorta. Okay. What is this branch right here from the aorta?
Inferior mesenteric artery.
How do you know it's inferior mesenteric? Because it's on top of the bifurcation of the yes. Very, very good, of the aorta. Okay. Any other questions so far? Is it easy? Yeah, superior mesenteric. This is the inferior mesenteric artery, sorry. Okay, what is this muscle right here? Psoas major. What is this muscle right here? Psoas major. Okay?
So do we do right or left or just right psoas major only?
Yeah, I mean, this is easy. This is the right and this is the left. Does it matter?
You mean if they point to the ureter, you mean that to right ureter?
Yeah. Yeah, on the body, yeah. Sorry? Okay, let's go to another body. Whoever saw, please move along. Whoever did not see, please stay. Okay? See this right here? This is the Mercedes sign. This is the Mercedes sign. The one going up is the left gastric. The one going to the right is the hepatic. The one going to the left, splenic. Below by 1 inch and branched is the superior mesenteric. Understood? This one. The vertebral column. Okay? Where's the vertebral column here? Yes. After the vertebral column, I start to count the tubes. This is the first tube, right? This is always rectum, either in male or in female. It doesn't matter. The first tube that you meet is the rectum. Okay? How many tubes after that? 1, right? Yep. So this is a male. So this is a male. This is a male. Okay? This is a male. So this is the rectum. This is the urinary bladder. This is the urinary bladder. Okay? Let's try the same thing here. Let's try the same thing here. Where's the vertebral column here? Here. Where's the first tube? This is the first tube. So this is the rectum. Where's the second tube? Uterus. The third tube. So closed like this. It's supposed to be closed like this. Okay? Understood? So the first thing you look at is the vertebral column. Count how many tubes? 2, male. The first tube you meet is the rectum, then the bladder. 3 tubes, rectum, uterus. Okay? If he wants the rectum, it'll be all the way up here. If he wants the anus, it'll be all the way down here. If he wants the what's it called? The uterus up here, all the way down here is the vagina. This is called the urinary bladder. Okay? This is the common area. The one going inside of the pelvis is the internal, the one outside is the external. Okay? Easy? Okay? What else? Okay, in the male, there's something special in the male, is the prostate. Yes. So if it comes right here and says, what is this? Prostate. If he wants the bladder, it'll be all the way up here. Here? Prostate. Okay? Prostatic urethra. Prostate. These are the two things that come in the male, okay? Rectum, anal canal, bladder, and the prostate. Understood? Easy? Okay, very easy? Or just easy? Sorry. The prostate, let me get you another one, easier one. Is this a male or a female?
Female, male.
1, 2, 3.
Male.
Nampak 3 biji. Dia nampak.
1, 2.
Kalau dia tinggal nampak.
Okay? 1, 2. Buckle my shoe. Okay? This is the rectum, this is the bladder. If it comes a pin or anything like here, what is this? Prostate. Right away, prostate. Understood? Right here. It's at the neck of the bladder. It's at the neck of the bladder. Prostate. Understood? Okay? Move on? Move on. What is this right here? So what does this nerve I have right here? Obturator. Very, very good. It could come like this. Lumbosacral. Can you find it? Knee. Yes. It's knee right here. Okay? Okay, so this is the obturator and below it is the lumbosacral. If it come in here, easy. Understood? So this is the pelvis. Easy? Oh, that's all.